Yeah. So yesterday we have finished till here. Till efficacy, I think we have finished, right? And from today, like it's a session two, or we can say, yeah, session two or part two of this LMT session related to this PCM, this PSM 50 plus topics. ठीक है, PSM 50 plus topics का हम start करते हैं. So over here today we will start with from here, फ्रॉम दिस PQLI, और हम ये टॉपिक्स करेंगे जहां जहां से हमारे और पॉसिबल क्वेश्चंस आ सकता है. ठीक है. आई होप एवरीवन हैविंग योर स्क्रिबल कॉपी विद यू एंड writing along with me, not to write everything, just to write the volatile things, just to write the volatile things जो जो हम भूल जाते हैं. ठीक है. So let's start. Over here we have these two indicators, that is PQLI, this index, and this HDI. What do you mean by PQLI? PQLI means the physical quality of life index, and HDI means human development index. Please remember about PQLI. It's physical quality of life index and it is the human development index. दोनों में कंफ्यूज बिल्कुल नहीं होना. इसमें अगर हम बात करें तो वी जस्ट हैव टू रिमेंबर LILL. L for literacy rate, L for literacy rate, I for infant mortality rate, I for income. देखो डिफरेंस कहाँ है. Over here I means infant mortality rate, over I means income, and L over here life expectancy, life expectancy. अच्छा, अगर HDI में बात करें तो life expectancy is at birth, and over here life expectancy at 1 year, at 1 year. ये अगर हमारा क्लियर हुआ कि इसमें क्या क्या पैरामीटर्स आएंगे इंडेक्स में, कि दिस इज समथिंग, कौन कौन से इंडिकेटर्स आएंगे, दैट इज योर लिटरेसी रेट, इन्फेंट मोर्टेलिटी रेट, इनकम. ओवर ईयर लाइफ एक्सपेक्टेंसी, लाइफ एक्सपेक्टेंसी. एचडीआई में लाइफ एक्सपेक्टेंसी रहेगी एट बर्थ, और यहाँ पे लाइफ एक्सपेक्टेंसी रहेगी एट 1 ईयर. ठीक है. नेक्स्ट क्वेश्चन दे कैन आस्क यू. देखो लिटरेसी रेट को, जो लिटरेसी रेट है, दे कैन ऑल्सो राइट दिस लिटरेसी रेट like knowledge. Also they can refer to this literacy rate as a education index, as a enrollment ratio, and also mean year of school, mean year of school. So आपको ये ध्यान देना है कि जरूरी नहीं है एग्जाम में they will just write this literacy rate. They can also write this literacy rate with other technical terms. So these are all other technical terms which can be replaced from this literacy rate. Also you have to remember that in among this which is the most important index. So question usually comes over here, तो हमको याद रखना है mean year of school is the most important index. Also please remember about income. HDI में हम income की बात करें तो income is usually measured per capita in US dollar, in US dollar, that is purchasing power parity. This is what you have to remember. ठीक है. तो इनके जो अलग और तरीके से वो पूछ सकते हैं, they can just mention these things in a word form, in a statement form. So you have to be very 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 precise during this. Also we have to remember about if life expectancy at birth can be written as like LE0, LEB और longevity. इस तरीके से वो इसको मेंशन कर सकते हैं, और LE birth. ठीक है, ये आपको ध्यान रखना है. इफ यू आर वेरी वेरी कंफर्टेबल विद दिस, लेट्स टॉक अबाउट दिस. इसमें भी हमारा लिटरेसी रेट था, इन्फेंट मोर्टेलिटी रेट था, एंड दिस इज लाइफ एक्सपेक्टेंसी एट 1 ईयर. प्लीज रिमेंबर कि जो पीक्यूएलआई होता है, पीक्यूएलआई का जो स्कोर होता है, और वी कैन से द वैल्यूज, the PQLI values is less than 100 but more than 0, less than 100 but more than 0. And in HDI, please remember the values ranges from 0 to plus 1, 0 to plus 1. So it is the HDI is less than, or we can say more than 1, or sorry, the less than 1 and more than 0. This is what you have to remember. So अगर मैं बात करूँ इंडिया की, if I ask the value of India, then please remember इंडिया का वैल्यू कितना होता है, 0.644, 0.644. So it shows that India is medium development country, medium development country, and our PQI for India is as of now is 65, 65. Now also please remember this literacy rate can also be referred as education, can also be referred as education. Also this infant mortality, or we can say this income, can also be written as living standard, living standard. Please remember. And also this life expectancy at 1 year or life expectancy at birth can also be referred as health. तो वो इन तीन को भी इंक्लूड कर सकते हैं, एंड दे कैन आस्क यू द फोर्थ वन विच इज नॉट अ पार्ट ऑफ दिस इंडिकेटर्स. सो प्लीज रिमेंबर, इन अ नटशेल, एजुकेशन, living standard and health are part of this indexes. This is what you have to remember. समझ में आया PQLI और HDI में से क्या क्या इंपॉर्टेंट याद रखना है? Please be very quick while responding, and then we'll move forward on this. Also, you have to remember about elimination. Please remember about elimination, that the level of elimination, if I talk about for leprosy, or we can say for neonatal tetanus, देखो elimination की, I hope कि you already know the definition of elimination, eradication, ठीक है, and also epidemic, endemic, उन सब की definition you are very clear. But over here I just put this information so that you can remember about elimination level of leprosy and this neonatal tetanus. देखो, elimination level of leprosy is usually less than one case per 10,000. Please remember, it's very important. Leprosy का elimination level is less than one case per 10,000 population, and same if I talk about this neonatal tetanus, then the elimination level is less than one case per thousand live birth. This is what you have to remember. Very important. Next, I would like to discuss about कि जिसपे हमारा क्वेश्चन आने का चांसेस है, that is iceberg phenomena. Iceberg phenomena, देखो iceberg phenomena आपको पता रखना होना चाहिए. Iceberg phenomena means the difference between this apparent cases and inapparent cases. Now what do we mean by this? Usually iceberg phenomena क्या होता है कि let's say कि अगर इफ आई सी ऑन द सी लेवल, अगर मैं सी लेवल पे देखूं और बाहर मुझे ऊपर कोई चट्टान दिखती है, ऊपर से मुझे देख के क्या लगेगा कि हाँ जो दिख रहा है बस वही है, बट नहीं, जो दिख रहा है पोर्शन अबाउ द सी लेवल इज लिटिल बिट लेसर इफ आई कंपेयर टू, लेकिन जो डीप साइड है, इट्स अंडर द सी विच वी आर अनेबल टू सी, is much deeper if I compare from the outside. So this is something a iceberg phenomena. This iceberg phenomena also takes place a major role over here. So what we have to learn, this is something your tip. इसको हम क्या बोलते हैं? टिप बोलते हैं. And this is something you have to remember. This is a hidden or we can say submerged part. ठीक है? This is a hidden or submerged part. ये जो टिप होता है, it says about cases. ये किसके बारे में बताता है? Cases के बारे में बताता है. And also this tells about carriers. So disease की जितने भी carriers है, this is actually submerged or we can say hidden part, and this is your tip, which is something we can say it shows the cases. Please remember that what do you mean by this line? What do you mean by this line? This line is nothing but you have to remember that this line is a line of demarcation which is between your apparent cases and inapparent cases. This is what you have to remember. Please remember on over here कि ये वाला जो पार्ट है ये हमारा कैरियर्स को रिप्रेजेंट करता है, एंड दिस इज समथिंग सबमर्ज और हिडन पार्ट, राइट? एंड दिस टिप actually represents the all the clinical cases. Also एक क्वेश्चन आता है, they usually ask over here that जो टिप है, this tip or we can say this cases is detected by, these are detected by, आप बताओ, these are detected by, and these carriers the over here these are detected by, जो
Screening.
सबमर्ज वाला पार्ट है, ये टिप is detected by diagnosis. This is detected by diagnosis, and the submerged part or we can say this carrier, these are diagnosed by these are detected by screening. This is what you have to remember. Okay, this is what you have to remember related to iceberg phenomena. Now please remember that this iceberg phenomena is not shown by which diseases. देखो अभी मैंने आपको क्या बताया कि any disease having carrier will show iceberg phenomena, right? Over here this is submerged part में. अब कौन कौन सी डिजीज जो है वो आइसबर्ग फिनोमेना शो नहीं करती, दैट व्हाट आई हैव टू रिमेंबर. सो प्लीज रिमेंबर फ्रॉम दिस मिस्टर आरटीपी. सो एम फॉर मीजल्स, आर फॉर रूबेला, आर फॉर रेबिस, टिटनस एंड पर्टुसिस. जस्ट टेल मी, इनका कैरियर ही नहीं है तो ऑब्वियसली ये आइसबर्ग फिनोमेना भी शो नहीं करेगी. दिस इज व्हाट यू हैव टू रिमेंबर. एक क्वेश्चन यहाँ से आता है, ठीक है, एक क्वेश्चन यहाँ से आता है. ऑल्सो दे कैन आस्क यू रिलेटेड टू दैट this iceberg phenomena is shown by, best iceberg phenomena is shown by malnutrition. तो यूजुअली होता क्या है कि देख के आपको इतना नहीं लगेगा कि हाँ इसमें कुछ ज्यादा है, लेकिन इफ यू आस्क देयर इंटरनली then there must be going a lot of things. So that is something malnutrition. Also please remember this HIV, diabetes mellitus, TB, they also show a good phenomena. यानी apparently तो वो healthy दिख रहा है, लेकिन अंदर से he or she is so much unhealthy and having that disease. So this is something a iceberg phenomena you have to remember. So please remember about iceberg phenomena. Best is shown by malnutrition, and which diseases do not show iceberg phenomena. It is Mr. RTP. Okay, and please remember this is something your line of demarcation. So if I talk over here this, then you this is something you can see कि जो submerged part है, submerged part है वो बहुत less है, submerged part बहुत less है if I compare to this tip, if I compare to this tip. So this is something your, so this is you can see no carrier, no iceberg phenomenon. समझ में आया? I want a verbal response from everyone. समझ में आया आप लोगों को?
Yes, भैया.
ठीक है. Next, we have to remember about this types of epidemics. Type of epidemic, देखो types of epidemic में you have to be very clear. We have this single exposure point source epidemic. Over here we have this multiple exposure point source epidemic, and this is something you have to remember, propagated epidemic. I know most of the things you already knowing about these things, but still let's refine those things. So over here, please remember this point source epidemics is also known as common source epidemics. तो अगर वो point की जगह common लिख दे तो you don't have to be confused. You have to be very attentive कि हाँ वो वही चीज है. ठीक है? This is what you have to remember. So over here, to understand this single exposure point source epidemics, let's take an example. So let's say कि एक मैरिज है, वहां पे let's say कि 1,000 गेस्ट आए थे and they are eating that food during the party, and let's say that food is contaminated, or we can say there is a food poisoning. ठीक है? तो क्या होता है, यूजुअली वी नो दैट द स्टेप फूड पॉइजनिंग का जो इंक्यूबेशन पीरियड होता है, इट इज फ्रॉम 1 to 6 hours, 1 to 6 hours, and you being in an hospital, you being an intern and you are sitting in a hospital, and let's say if you are posted in emergency, and you will see a lot of cases of food poisoning are coming to you. Then by taking the history, then definitely most of the जो इंडिविजुअल्स है वो कहाँ से आए होंगे, फ्रॉम दैट मैरिज, फ्रॉम दैट पार्टी. ओके, देन वी एज्यूम कि हाँ वहां पे कहीं ना कहीं इतने सारे लोगों को अगर एक्सेप्ट फूड पॉइजनिंग हो रहा है, तो दैट फूड मस्ट बी कंटामिनेटेड. तो क्या होगा, लेट्स से अराउंड 8 p.m., लेट्स से अराउंड 8 p.m. the patient started coming to your hospital, and then they will be continued till 12 a.m. to like maybe 1 a.m. क्यों? Because this is the incubation period from 1 hour to 6 hours. तो cases will start rising. There will be sudden rise. There will be sudden rise. There will be sudden rise. ठीक है? एक point तक आते आते then there will be fall in the cases. There will be fall in the cases. So what do you mean by this sudden rise in the cases? देखो, this sudden rise in the cases is because of this range of incubation period. So this is something which we called as clustering. Clustering. So जितने भी एक sudden rise of cases आता है during the first incubation period is called as क्लस्टरिंग. दिस इज व्हाट यू हैव टू रिमेंबर. तो यहाँ पे हमको क्या क्या कंपोनेंट याद रखना है कि यहाँ पे सिंगल एक्सपोजर हुआ. देखो सिंगल एक्सपोजर क्यों, एक साथ सबने खाना खाया, उसकी वजह से सिंगल एक्सपोजर. सोर्स क्या था, खाना. दैट इज अ पॉइंट सोर्स, अ कॉमन सोर्स. दैट फूड वाज एक्टिंग एज अ point source. So this is something you have to remember. Single exposure, point source epidemic. So please remember this clustering of cases in first incubation period. This is something you have to remember. This is clustering. This collection, or we can say the sudden rise in the first incubation period, is called as clustering. समझ में आया?
Yes.
Just a second. Yeah. Next, we have to remember related to multiple exposure points of epidemic. देखो, the word is still itself saying multiple exposure. Let's say an example related to a contaminated well. Let's say in a village there is a contaminated well, and because of that population of that village is actually drinking the water from that contaminated well. Let's say कि उसके पीने की वजह से लोगों को टाइफाइड होने लगा. एंड टाइफाइड का इंक्यूबेशन पीरियड कितना होता है, 10 to 14 days. 10 to 14 days. तो स्टार्टिंग में क्या होगा, लेट्स से कि if the you being posted in the PHC of that village, and you are looking to that कि अब धीरे धीरे केसेस टाइफाइड के आने लगे. ठीक है, there will be a sudden rise in the cases, there will be sudden rise in the cases, then there will be a fall in the cases. This is because of this first incubation period. स्टार्टिंग में थोड़े लोग आए, क्योंकि it is not for hours, it is for days, from 10 to 14 days. Let's say स्टार्टिंग में कुछ पॉपुलेशन ने ड्रिंक किया, and then they are contaminated with that disease, that is typhoid. तो हाँ, आपके पास केसेस आएंगे एंड देन दे विल बी फॉल इन द केसेस, क्योंकि इंक्यूबेशन पीरियड का रेंज बड़ा है. फिर कुछ लोग जाएंगे पानी पीने, देन दे विल आल्सो बी अफेक्टेड, देन देयर विल फॉल इन द राइस एंड दिस स्टोरी विल गोज ऑन, दिस स्टोरी विल गोज ऑन. ठीक है. अब क्या होगा, this you have to remember, this multiple peaks are called as secondary waves. Secondary waves, why multiple peaks? Because multiple incubation period. Why multiple incubation period? Because multiple exposure, बार बार जाके, if you are going to that well and drinking contaminated water, so obviously there will be a multiple incubation period, because multiple population, lots of population drinking at multiple phases, अलग अलग time पे पी रहे हैं, right? So this is something you have to remember as a multiple exposure points of epidemic. I hope this is also clear to you. If I talk about this propagated epidemics, you have to remember that it is shown by person to person transmission, so there will be a slow rise, there will be a plateau, means there is no peak, तो यहाँ पे आपको याद रखना है, over here the multiple peaks will be called as secondary waves. और यहाँ पे क्या कंपोनेंट याद रखना है, this range is something called as clustering, this is what you have to remember, and this is something my propagated epidemic. Please remember that one case of TB can spread to 10 to 15 cases per year. This is what you have to remember, very 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 important. ठीक है. नेक्स्ट, प्लीज रिमेंबर द टाइप्स ऑफ स्क्रीनिंग. यहाँ तक समझ में आया आप लोगों को? समझ में आया? टाइप्स ऑफ एपिडेमिक समझ में आया? PQLI HDI समझ में आया? एलिमिनेशन और आइसबर्ग फिनोमेना, ये इंपॉर्टेंट क्वेश्चन जो जो पॉसिबल आ सकते हैं इस टाइम, वी हैव डिस्कस्ड. आई वांट अ वर्बल रिस्पॉन्स फ्रॉम ईच वन ऑफ यू. समझ में आया?
Yes,
लेट लेट मी सी हाउ, लाइक कितने जने एक्टिव है अभी.
Yes, sir.
Yeah, good. Next, over here, we will be talking about like types of screening. So just giving you 1 minute break, फटाफट इसको zoom करके you can zoom, and also you have to revise it. आप इसको revise करो, ठीक है? Just a 1 minute break. फटाफट देखो क्या क्या हमने पढ़ा है, and then we move forward. Okay. Now let's discuss about the types of screening. I hope कि आपने पहले पढ़ा होगा, and over here it's a revision for types of screening because it's very very high yielding. First of all, we have to remember mass screening. I have high risk screening. I have multi-phasic screening, multi-purpose. Please do not confuse. It is also MP. It is also MP. Multi-purpose, multi-phasic. Okay. And over we have this opportunity screening. Please remember about mass screening. It applies on large population. Like for example, chest X-ray to elderly. Why? Usually once like 2 year we have to go for this chest X-ray, because for the screening of the lung cancer. So this is an example. So for the word saying mass screening, mass means large population. When you are this this screening, like when screening is applied on large population, that type of screening will be called as mass screening. Next, we have this high risk screening. High risk screening will be like selective type of screening. The word still saying high risk. तो ऑब्वियसली किस में होगा? वो हाई रिस्क ग्रुप में ही हम इसको करेंगे. सो ओवर हियर लेट्स टेक एन एग्जांपल लाइक HIV स्क्रीनिंग अमंग द कमर्शियल सेक्स वर्कर. Commercial sex worker will actually be this HIV screening वहां पे. तो this is the example of high risk screening. Next, we have this multi-phase screening, multiphasic screening. Multiphasic screening means more than two tests to the large number of people. Like for example, annual health checkup. Health checkup. So it's already been asked. It's a PYQ, direct PYQ. तो you have to remember कि अच्छा annual health checkup जो है, This is something an example of multiphasic screening. Multiphasic screening, and for multi-purpose, more than two tests to detect more than one disease. The best example is during pregnancy. We go for this like HIV, HBV, HCV वगैरह के लिए we go for, so we go for more than two tests to detect more than one disease. And next we have this opportunistic screening. In this, like for example, this rheumatic fever, or we can say rheumatic heart disease की screening किसमें, school children में. So we got an opportunity to go in the school for the screening for this RF and RHT. This is how you have to remember. ठीक है, एक ही पर्पस में, like I got a purpose to solve multiple, or we can say to test multiple diseases from multiple tests in a go. So that is multi-purpose screening. And multiphasic means more than two tests to a large number of people. ठीक है, who gonna revise this for me? कौन एक verbal response में इसको पढ़ेगा? Who gonna revise this for me?
Yes.
Yeah, Sandesh, please.
For mass screening, we should apply on large population like chest X-ray for elderly person once 2 year because of lung cancer, risk of lung cancer and high risk screening is selectives, HIV positive and among the
Commercial
sex
sex
worker,
worker.
commercial sex workers in the
Mhm.
high risk. And the multiphasic screening, we can choose more than two tests to large number of people, and this is an annual health checkup.
It's an example for multiphasic
Annual health
screening.
checkup.
ठीक है, हाँ, very good.
And the another one multi-purpose screening, it detects two tests in and greater than one disease, like example pregnancy, HIV, HBV, SCV.
Pregnancy के अंदर, whenever a patient is coming to you as a pregnant patient, you will go for this HIV, HBV, HCV. देखो, more than two tests to detect more than one disease, right? More than two tests to detect more than one disease. तो obviously एक पेशेंट एक ही था, प्रेग्नेंट फीमेल थे, लेकिन उसमें हमने मोर एक ही टाइम पे वी हैव गॉन थ्रू मोर देन टू टेस्ट टू डिटेक्ट मोर देन वन डिजीजेस. ठीक है, या
And opportunistic, this one for
रेमोटेड फीवर, रेमोटेड फीवर
rheumatoid
एंड
fever
रेमोटेड
and
हार्ट डिजीज.
heart disease in children, school children's.
ठीक है, तो दिस इज व्हाट यू हैव टू रिमेंबर. नेक्स्ट आई वुड बी टॉकिंग अबाउट स्क्रीनिंग टेस्ट प्रॉपर्टी. स्क्रीनिंग टेस्ट प्रॉपर्टी वेरी 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 इंपॉर्टेंट, वेरी हाई यील्डिंग, है ना. इससे क्वेश्चन आ सकता है बाय गिविंग दिस टाइप ऑफ टेबल. तो हमको कैसे इसको बनाना सीखना है. फर्स्ट ऑफ ऑल लेट्स understand that how things work over here. So you have to remember over here, let's take a disease like HIV. हम disease ले लेते हैं, ठीक है, HIV हम disease ले लेते हैं, ठीक है. over here I am taking that ELISA का result, ठीक है. so let's consider over here a disease is present and also ELISA का जो रिजल्ट है वो भी बता रहा है कि हाँ डिजीज पॉजिटिव है, ठीक है. इन एन इंडिविजुअल disease is absent but ELISA test asking like telling about disease is present. over here ELISA आ रहा है negative but disease is actually present. and over here this ELISA is also negative but disease is also negative. ठीक है, तो जैसे कल हमने जो odds ratio बनाना सीखा था उस तरीके से we'll try to understand it. ठीक है, so let's take an example. this is an HIV and for that I'm going for a screening test, let's say ELISA. ठीक है, so this is what you have to remember. disease present, this is absent. ELISA screening test shows disease present and it shows disease absent. ठीक है, this is how you have to remember. so this will be a case like उसको HIV भी है और एलाइजा की स्क्रीनिंग में पॉजिटिव भी आ रहा है, तो दैट विल बी अ ट्रू पॉजिटिव केस. ट्रू पॉजिटिव मींस हाँ उसको HIV भी है और एलाइजा में भी स्क्रीनिंग में भी पॉजिटिव आया, तो ऑब्वियसली ट्रू पॉजिटिव केस. ठीक है, in next scenario you have to remember if the is disease is absent and in ELISA also it says disease is absent, so over here that will be true negative. Why true negative? देखो disease भी absent है और एलाइजा भी क्या बोल रहा है कि डिजीज एब्सेंट है, तो दिस विल बी योर ट्रू नेगेटिव एंड दिस विल बी योर ट्रू पॉजिटिव। ठीक है, नेक्स्ट यू हैव टू रिमेंबर द केस कि HIV पॉजिटिव है, HIV पॉजिटिव है, लेकिन एलाइजा बता रहा है कि दैट पर्सन हैज नॉट that disease, but actual में that person is suffering from that disease, but screening test says it is negative, it is negative, then it will be a false negative, false negative। मतलब कि ये जो हमारा स्क्रीनिंग टूल है ये फॉल्सली नेगेटिव बता रहा है। व्हाई? क्योंकि उसको इंडिविजुअल को एक्चुअली ही इज सफरिंग फ्रॉम दैट डिजीज। ठीक है, नेक्स्ट नेक्स्ट प्लीज रिमेंबर दिस इज समथिंग इन HIV। HIV उसको डिजीज नहीं है, लेकिन the ELISA test says that he is positive, so this is something a false positive, false positive मतलब ये falsely positive बता रहा है, but the individual is not suffering from that disease, so this is something false positive। Now you tell me which among will be the most serious, which among will be the most serious, true positive, फॉल्स पॉजिटिव, फॉल्स नेगेटिव और ट्रू नेगेटिव, कौन सा इसमें सबसे ज्यादा सीरियस कंडीशन होगा? false negative। why? because by this looking to the screening you will say this individual okay आपको HIV नहीं है, but actually he had this HIV, so this is something you have to remember कि which among is the most serious, this false negative is the most serious। now over here also we have to arrange in the same way जैसे हमने कल सीखा था A B C D। please remember this is how we have to arrange, this is like A B C D, and then we have to go for cross multiplication, we have to go for cross multiplication in case of we will talk about that, but right now we have to just focus over here, this is true positive, true negative, false positive, false negative। ये समझ में आया आप लोगों की कैसे ये टेबल बनानी है? इतना समझ में आया? if you are good to go to this, then we have to remember कि अच्छा this A implies means true positive, this B implies false positive, C implies this false negative, and this D implies this ट्रू नेगेटिव, ट्रू नेगेटिव। प्लीज याद रखना। अब हम बात करेंगे सेंसिटिविटी, जस्ट सेकंड, सेंसिटिविटी ऑफ स्क्रीनिंग टेस्ट एंड स्पेसिफिसिटी ऑफ दिस स्क्रीनिंग टेस्ट। ठीक है, अब सेंसिटिविटी अगर हमको समझना है, सो प्लीज 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 रिमेंबर वी हैव अ फॉर्मूला दैट इज ए बाय ए, जस्ट सेकंड, ए बाय ए प्लस सी इंटू 100। ठीक है, ए बाय ए प्लस सी इंटू 100। प्लीज रिमेंबर, देखो सेंसिटिविटी, सेंसिटिविटी तो वी आर जस्ट टेकिंग टू ट्रू पॉजिटिव, सो दिस इज वी आर टेकिंग दिस ट्रू पॉजिटिव। तो आपको कैसे याद रखना है कि एक तो एक फॉर्मूला में मुझे ट्रू पॉजिटिव लेना है, एक फॉर्मूला में मुझे ट्रू नेगेटिव लेना है। सो इफ आई एम टेकिंग दिस ट्रू पॉजिटिव, ट्रू पॉजिटिव लाइक ए बाय ए प्लस सी into 100, so over here true positive divided by true positive plus false negative, false negative। so in sensitivity I will take this scenario, this scenario, तो उसमें कैसे हो जाएगा मेरा ट्रू पॉजिटिव डिवाइडेड बाय ट्रू पॉजिटिव प्लस false negative, false negative, this is into 100। ठीक है, this will be my sensitivity। अगर मैं स्पेसिफिसिटी की बात करूं तो the formula will start from lower side, यानी कि ट्रू नेगेटिव डिवाइडेड बाय ट्रू नेगेटिव प्लस फॉल्स पॉजिटिव। तो सेंसिटिविटी में फॉर्मूला स्टार्ट करेंगे ए से, ए बाय ए प्लस सी इंटू 100, एंड स्पेसिफिसिटी में आई स्टार्ट फॉर्मूला फ्रॉम डी, डी बाय डी प्लस बी। तो क्या हो जाएगा, इफ यू लुक ओवर योर ट्रू नेगेटिव प्लस फॉल्स positive, so this is true negative plus false positive into 100 will be my specificity, and for sensitivity true positive divided by true positive plus my false negative, so this will be my into 100, तो this will be my sensitivity। समझ में आया आप लोगों को कि फॉर्मूला कैसे बनाए? समझ में आया सेंसिटिविटी और स्पेसिफिसिटी का? जस्ट यू हैव टू रिमेंबर वन थिंग कि इस सेंसिटिविटी में मैं ट्रू पॉजिटिव को ऊपर रखूंगा एंड स्पेसिफिसिटी में मैं ट्रू नेगेटिव को ऊपर रखूंगा। दिस इज व्हाट यू हैव टू रिमेंबर लाइक एज अ डिनोमिनेटर। नेक्स्ट इफ आई आस्क यू टू रिमेंबर अबाउट दिस positive predicted value and negative predicted value, so please remember this positive predicted value will go in this way, will go in this way, यानी कि कैसे a by a plus b into 100 into 100, this is what you know, a by a plus b into 100। now what do you mean by a by a plus b? so please remember this is something your true positive divided by true positive प्लस फॉल्स पॉजिटिव इंटू 100 इंटू 100। तो जब मैं पॉजिटिव प्रिडिक्टेड वैल्यू देख रहा हूँ, See, I am going for positive predicted value, पॉजिटिव पॉजिटिव पॉजिटिव, ठीक है। तो तीनों कंपोनेंट जो होंगे वो पॉजिटिव के होंगे। सो फॉर पॉजिटिव प्रेडिक्टेड वैल्यू माय डायरेक्शन टू मेक द फॉर्मूला विल बी लाइक दिस, एंड फॉर नेगेटिव प्रेडिक्टेड वैल्यू to make this formula my direction will be like this. So over here you can see now I have this true negative divided by this false negative plus this is true negative. So this is my negative predicted value. So this is negative 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 100 to 100. So this is my positive predicted value, this will be my negative predicted value, ठीक है। तो ये तो हुआ हमारा, अगर मैं कुछ मुझे पॉजिटिव प्रेडिक्टेड वैल्यू का फॉर्मूला बनाना तो my direction will be like this, and for negative predicted value my direction will be like this. For sensitivity my direction will be like this, and for specificity my direction will be like this. समझ में आया आप लोगों को कैसे फॉर्मूलाज बनाना है? आई होप थिंग्स आर वेरी वेरी क्लियर टू यू। ओवर हियर यू हैव टू रिमेंबर इट्स सेंसिटिविटी, ओवर हियर यू हैव स्पेसिफिसिटी। समझ में आया? ओके, nice. So this is what you have to remember about types of screening, and this is screening test property, screening test property, ठीक है। Now next क्वेश्चन वी विल बी टॉकिंग अबाउट दिस आईओडीज। आईओडीज पे भी क्वेश्चन आता है, ऑलरेडी यहाँ इस बार भी आया था, दे कैन रिपीट दिस क्वेश्चन। सो प्लीज प्लीज रिमेंबर आईओडीज मींस सी फर्स्ट जनरेशन आईओडी, वी हैव सेकंड जनरेशन ऑफ आईओडी, एंड वी हैव दिस थर्ड जनरेशन ऑफ आईओडी। First generation of IUD means non-medicated, non-medicated. So that will be called as inert IUD, inert IUD, that is Leaps loop, Leaps loop. So this is a visual question they can ask you. Please remember this already been asked this time also. Over here, please remember the second generation are copper IUDs, copper IUDs, and this third generation will be hormone based IUDs. Please remember the second generation and third generation are medicated, and first generation is नॉन मेडिकेटेड, ठीक है। आर यू गाइज विथ मी? आर यू गाइज विथ मी? समझ में आ रहा है आप लोगों को? स्पीड ठीक है मेरी? आई होप दिस इज नॉट सो फास्ट एंड यू ऑल आर कंफर्टेबल, ठीक है। सो ओवर हियर सो दिस इज अब माय सेकंड जनरेशन एंड थर्ड जनरेशन। सेकंड जनरेशन मैंने क्या ऐड किया कि हाँ कॉपर बेस्ड, एंड थर्ड जनरेशन इज हार्मोन बेस्ड। प्लीज रिमेंबर दीज आर मेडिकेटेड, दीज आर नॉन मेडिकेटेड, एंड आल्सो दिस विल बी कॉल्ड एज बायोएक्टिव आईयूडीज, बायोएक्टिव आईयूडीज। Now what I have to remember about second generation, please remember second generation हमने क्या सीखा? कॉपर बेस्ड होता है। So we have this copper T 380A, we have this copper T multi-load 375, copper T7 and copper T 220B. What we have to focus over here, what do you remember the 380? देखो, this 380 means it is actually telling about the surface area of that copper in mm square. This is what you have to remember. Both this copper T380A and this copper T multi-load 375 both are available in RCH program of India. This is what you have to remember. Very very important, ठीक है। तो copper T 380A and copper T multi-low 375. If they ask you to detect this, please confuse बिल्कुल नहीं होना है, just remember this 375 copper T 375 has 5 has these two curves. Over here also we can see we have this two curves. Over here also we have this two curves. So this is your multi-load copper T 375, and the straight one, that is A, can be remembered as copper T380A, copper T380A. This is what you have to remember. So this is in a nutshell for about first generation, second generation. Now what question they can ask you related to this third generation IODs? So please remember these are like प्रोजेस्ट्रैट। तो वो आपसे क्या पूछेंगे? They will ask you this dose कि कितना रिलीज होता है, कितना डोज रिलीज होता है फ्रॉम दिस प्रोजेस्ट्रेट। प्लीज रिमेंबर दिस प्रोजेस्ट्रेट, इसमें इट रिलीज द frequency is 65 microgram per day, 65 microgram per day. So everyone please write this value, that is 65 microgram per day, is very 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 important. They can ask you kitna release hota hai progesterone, that is your 65 microgram per day. And this LNG IUDs, LNG IUDs, this is what you have to remember. These two types of IUDs you have to remember, you have to remember, ठीक है। नाउ ऑल्सो प्लीज रिमेंबर अबाउट शेल्फ लाइफ। शेल्फ लाइफ के बारे में भी आपको याद रखना है। शेल्फ लाइफ ऑफ कॉपर टी इज 3 to 5 years। कॉपर टी 380A का शेल्फ लाइफ कितना होगा? 10 years। एंड कॉपर टी 375 का कितना होगा? 5 year। या शीतल प्लीज डिवाइड दिस फॉर मी इन अ वर्बल रिस्पॉन्स।
Yes, sir. Shelf life of CUT is 3 to 5 years. Then copper T 380A for 10 years and copper T 375 for 5 years.
ठीक है, तो कैसे याद रखेंगे? कॉपर टी
Double
थ्री, हाँ,
double curve. Yes, sir.
डबल कर्व, ठीक है, एक तो ये भी हो जाएगा। और 375 has 5 at last, so 5 year, it has 0, so we'll have 10 years, ठीक है। This is how you have to remember, and life, this shelf life property like 3 to 5 years, ठीक है, ये हमारा हो जाएगा। Next, there are some questions related to IUDs जो usually frequently पूछते हैं, and we have to revise them. Questions on IUDs. So first question, they will make a clinical scenario, and then at the end of the day, question का meaning क्या होगा? They will ask you that bleeding after IUD, bleeding after IUD indication. Then what would be the treatment? What would be the treatment? देखो, अगर सिर्फ ऑप्शन में reassurance है, and also they are giving an option for this iron supplementation, that iron supplementation, then please prefer iron supplementation as an answer, ठीक है। if they are giving a clinical case जिसमें हमारा iron supplementation नहीं हो, दूसरा ऑप्शन है, तो वहां पे reassurance, and next they can give you this combination, वो combination में भी दे सकते हैं। so best answer will be reassure प्लस आयरन सप्लीमेंटेशन, और इन दोनों में से अगर हमको एक चूज करना है तो आयरन सप्लीमेंटेशन would be my answer. Please remember, Fe, we will give this FeSO4, that is 200 mg TDS for 8 weeks. For 8 weeks. Please remember very very highly. तो एक clinical scenario आपको देंगे, and they will ask you about the treatment that bleeding after IUD indication क्या होगा, then you have to go for that. We will have to reassure that patient, and also we will give this iron supplementation. Dose कितना होगा? It is 200 mg TDS for 8 weeks. Also, if both is not given in option, then we have to prefer iron supplementation, ठीक है। next question वो आपसे पूछेंगे, after this IUD indication, there is a pain. In that pain, we have to go for this remove IUD. Remove IUD. Also, please remember this IUD with pregnancy. IUD with pregnancy, then we will go for this removing of those IUD. Also, we will go for this MTP under the social indication of this MTP Act. This is what you have to remember. So these are some possible questions they can ask you, and आपने GDs वगैरह में भी आपकी क्वेश्चन प्रैक्टिस में भी इनको देखा होगा, then आपको रियलाइज होगा कि कितना इंपॉर्टेंट पार्ट है। ऑल्सो प्लीज रिमेंबर, ऑल्दो फॉर्मूलाज के लिए मैं अलग प्लान करूंगा, बट ओवर हियर लेट्स आल्सो डिस्कस अबाउट दिस डिपेंडेंसी रेशियो। देखो, डिपेंडेंसी रेशियो, व्हाट डू यू मीन बाय दिस डिपेंडेंसी रेशियो? Dependency ratio means how much non-earning population is dependent on earning population for the survival, ठीक है। let's say कि obviously in a family, more than, if an individual is more than 60 65 years, 70 or 80 years, he must not be going outside and earning, right? And also a student, or we can say children less than 15 years, would not be going outside the home and earning. So the dependency from 15 to 65 का जो age group है, that is something we have to remember, earning population, यानी कि this population is earning for this non-earning a population. This is how you have to remember. So if you talk about non-earning population में कैसे हो जाएगा? Dependency ratio is equals to non-earning divided by earning. So non-earning में कितना हो जाएगा? Less than 15 years of age plus more than 65 years of age, and this earning population will be range from 15 to 65 years of age. This is what you have to remember, the formula, very 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 high yielding. Over here also they will ask you to in the percentage also, let's say कि अगर आपको क्वेश्चन में गिवन है the total population for 0 to 15 years is 30%, and then more than 65 year will be 10%, तो ये आपको क्वेश्चन में दिया, and you have to calculate this dependency ratio। तो आप कैसे कैलकुलेट करोगे? देखो, 100% पॉपुलेशन है, 100% पॉपुलेशन है, उसमें से 30% हो जाता है हमारा 0 to 15 ईयर, एंड 10% becomes my more than 65 years. It means total 40%, total 40% of 100%, तो 60% हमारा क्या हो गया? 60% हमारा क्या हो गया? Earning population. So over here, if dependency ratio is equals to 30% for less than 15 years plus more than 65 year में कितना है? 10%, ठीक है, divided by 60%, if you will calculate, it will be your 60 was 0.66, यानी कि 66 non-earning population is dependent on this population. This is what you have to remember. This is what you have to remember. Like out of 100, 66 are dependent on this अर्निंग पॉपुलेशन. समझ में आया आप लोगों को? समझ में आया डिपेंडेंसी रेशियो? समझ में आया डिपेंडेंसी रेशियो? हाउ यू हैव टू सॉल्व दिस क्वेश्चंस? सो गिविंग यू 1 मिनट हेल्दी ब्रेक, जिसमें आप फटाफट रिवाइज कर लो हमने क्या क्या दिखा है. प्लीज रिवाइज दिस टाइप्स ऑफ स्क्रीनिंग, स्क्रीन टेस्ट प्रॉपर्टी, IUDs, and this dependency ratio, and also this question. ठीक है, please revise them and then we'll move forward. Okay, I hope you have revised it. Then we'll move forward to this screening and diagnosis. So before discussing about this screening and diagnosis, जिसको हम आराम से discuss करेंगे, let's discuss about this population pyramid. Population pyramid. First of all, please remember about population pyramid that this population pyramid is also known as age sex pyramid. This population pyramid is also called as age sex pyramid. ठीक है. Next question, please remember that over left side of this pyramid there will be males, and over here also on the right side of, you have to remember females. तो कैसे याद रखोगे? Females are always right. This is how you have to remember. As for this population pyramid, only for this population pyramid you have to remember that females are or right. So this is how you have to remember, and this is your histogram. ठीक है, this question they ask you. Next question also you have to remember that कि population pyramid में they will ask you related to the shape, also they will ask you related to span, and also they will ask you related to symmetry. अब देखो, what do you mean by this shape? Please remember this. The shape of the pyramid is an indicator of fertility pattern. The shape of the pyramid is an indicator of fertility pattern. First question क्या पूछेंगे? What will be the, what this shape actually implies? It implies about the fertility pattern of that population. Over here we have this, या तो हाई फर्टिलिटी हो सकता है या फिर लो फर्टिलिटी हो सकता है. अच्छा, हाई फर्टिलिटी का पिरामिड कैसे बनेगा? यू हैव टू रिमेंबर ओवर हियर दिस इज समथिंग एन अपराइट ट्रायंगुलर, अपराइट ट्रायंगल. अब अपराइट ट्रायंगल का मतलब दिस इज हैविंग अ नैरो टॉप एंड अ ब्रॉड बेस. एंड व्हाट डू यू मीन बाय दिस ब्रॉड बेस? ब्रॉड बेस का मतलब ये होता है यहाँ पे कि there are more children to this age group, and more children are dependent on this earning population. This is what you have to remember. So if we have this upright triangle, it is showing high fertility and having this developing, this means for the developing country. And in this case we have this low frequency. Now what do you mean by this low fertility? Low fertility means there's a bulging in the middle, bulging in the middle. What do you mean by bulging in the middle? Means this is something a working earning population. So this will be a spindle shaped. तो आपको क्या याद रखना है इन रिलेटेड विद द शेप को लेके आपको क्या याद रखना है? This is the indicator of fertility pattern. First question. Second question, if they are asking कि डेवलप कंट्री का शेप क्या होगा फॉर दिस pyramid, then you have to remember it will be spindle shaped. And for developing country, what will be the shape? It will be upright triangle. This is what you have to remember related to shape. ठीक है. About height, or we can say span, it actually represents the life expectancy. So for developing country, obviously there will be low life expectancy. So if you look over here, this is the age, like 85 to 89 for this developing country. तो यहाँ पे if you compare over here, this is same comparison, right? Obviously इसकी height कम है, if I compare to over here, right? So this is showing you high life expectancy, and this is showing a low life expectancy. The height will be shorter span, and over here a taller span. So this is usually for the developed countries, and this is usually for the developing countries. Okay. Next we have to remember about symmetry is actually indicative of sex ratio. Please remember, this symmetry is actually indicative of this sex ratio. So we have this, if this low sex ratio, or maybe we can say ideal sex ratio. So if you compare this, तो यहाँ पे क्या होगा, मेल्स थोड़े ज्यादा है if you compare to females. ठीक है. Over here also if you compare, this is asymmetry. So this asymmetry means there is low sex ratio. It is usually for the developing countries, and if you see for developed countries, there's usually an ideal sex ratio. So if you compare over here, male 3.1%, over here 3%, 3.2% मेल, 3.1%. तो ये हमारा एज ग्रुप हो गया, इस एज ग्रुप में कितनी पॉपुलेशन है, तो दिस पॉपुलेशन इज फॉर मेल, दिस पॉपुलेशन इज फॉर फीमेल. सो इफ यू कंपेयर दिस टू दिस, then this to this, so this will be kind of symmetrical. So this is what you have to remember. So in a nutshell, अगर मैं फिर से बोलूं, तो पॉपुलेशन पिरामिड में मुझे याद रखना है कि शेप जो है, शेप इज इंडिकेटर ऑफ फर्टिलिटी पैटर्न फॉर दैट कंट्री. अगर वो डेवलपिंग कंट्री है, तो ऑब्वियसली देयर विल बी हाई फर्टिलिटी, तो उसका शेप क्या होगा, अपराइट ट्रायंगुलर. इफ दैट फर्टिलिटी पैटर्न ऑफ दैट कंट्री इज हैविंग, लेट्स से अगर वो डेवलप कंट्री से, तो लो फर्टिलिटी पैटर्न होगा, और शेप क्या होगा पॉपुलेशन पिरामिड का, इट विल बी स्पिंडल शेप. ठीक है, ये तो हुई हमारी शेप की कहानी. नेक्स्ट वी हैव टू रिमेंबर डॉट स्पैन के बारे में मुझे क्या रखना, स्पैन मींस हाइट. सो आई माइट बी हैविंग दिस डेवलपिंग कंट्रीज, एंड आई माइट बी हैविंग दिस डेवलप्ड कंट्री. तो डेवलपिंग कंट्री का जो स्पैन क्या होगा, शॉर्टर होगा. And over here, the developed country का जो span होगा, that will be taller. Now what do you mean by this? This actually span represents my life expectancy. This is what you have to remember. And if I say about symmetry, it's indicative of sex ratio. ठीक है, याद रखना, as for symmetry, as for sex ratio. If any country, developing country, let's say, तो there will be asymmetry, and developed countries will have symmetry. समझ में आया पॉपुलेशन पिरामिड आप लोगों को समझ में आया? Great. Next we will be talking about screening and diagnosis. ठीक है, screening and diagnosis. Now to talk about the screening and diagnosis, we have this TB, we have this leprosy, we have malaria, HIV, breast cancer, cervical cancer, oral cancer, lung cancer, prostate cancer and diabetes. इसका स्क्रीनिंग आपको बहुत अच्छे से आना चाहिए, एंड डायग्नोसिस भी आपको बहुत अच्छे से आना चाहिए. ठीक है. इफ आई टॉक अबाउट दिस टीबी, देखो फर्स्ट ऑफ ऑल स्क्रीनिंग का मतलब ये नहीं होता कि ओनली कोई आप टेक्निक को परफॉर्म करोगे देन ओनली इट विल बी स्क्रीनिंग. नो, क्लिनिकल बेसिस से, क्लिनिकल हिस्ट्री can also be act as a screening. Like for example, in the case of TB, तो स्क्रीनिंग की अगर मैं बात करूं, in the case of TB, then if any patient he or she is coming with the history of cough for more than 2 weeks, directly we have to refer that patient for the diagnosis, for that sputum smear, for this AFB, acid fast bacillus, that is for Zn stain हम यूज करते हैं. तो we directly refer that patient for this sputum smear, or we can say CB-NAT. ठीक है. Also they will ask you to remember about the CB-NAT. First of all, please remember this CB-NAT is also known as gene expert test. And gene expert test is usually detect this MTB and also this This is also called as RIF test. Why this is also called a RIF test? Why? Because it detects rifampicin resistance TB. Rifampicin resistance TB. This is what you have to remember. Very very important. What is the full form of सी? व्हाट इज द फुल फॉर्म ऑफ सीबी नाट? सीबी नाट में ये बता दो सी क्या है? व्हाट इज सी इन दिस सीबी नाट?
Cartridge.
Cartridge best. Okay, good. Over here we have this mycobacterium tuber on this Zidane staining. Please remember this is these are the AFB rods. AFB rods. Over here, this you can see this is the beaded appearance. Now, what do you mean by ये जो beaded appearance आपको दिख रहा है? This beaded appearance is nothing but it's because of this mycolic acid. Mycolic acid. This is what you have to remember. ठीक है? So this is all about TB का screening diagnosis. About leprosy, देखो leprosy का भी क्या होगा? एक क्लिनिकल बेसिस पे स्क्रीनिंग होगा. It is hypoanesthesia of skin. This if any patient is complaining for this hypoanesthesia, it will be my screening. And for diagnosis, I will send for this clinical examination. So on the basis of skin lesions, we will go for this screening. This for diagnosis. So this is Mycobacterium leprae. These are non-beaded. Please remember these are non-beaded. And usually अगर आप देखोगे तो ये सिंगल मिलेंगे आपको. But over here you will see them in a globi in a group. ठीक है. Next we have malaria. अब देखो any patient who is coming with a history of fever in any case, किसी भी केस में अगर वो फीवर के लिए आता है, that will act as a screening for malaria. Over here you have to remember this. We go for this peripheral blood smear of this malarial parasite, and the stain we use is JSB. The stain we use, it is जसवंत सिंह भट्टा stain. ठीक है, that is JSB stain we use for this peripheral blood smear of malarial parasite. Now over here also please remember this peripheral blood smear में we have two smear, that is thick smear and we have thin smear. Thick smear actually provides sensitivity to test. It provides sensitivity to test and it tells about the presence. And in thin smear, it's a thin smear. It says about specificity. Means like for species identification. Why species identification क्यों करना है? Because उस accordingly हमको treatment देना पड़ेगा. So it's very high yielding. Please remember this is a thick smear which provides sensitivity to the test, and this is a thin smear which shows specificity of for the test. Why it is important? ताकि मैं species का identification कर सकूं, उस हिसाब से मैं treatment दे सकूं. ठीक है, this is what you have to remember, and this is a slide for Plasmodium falciparum. Next we have to remember about HIV का screening test क्या होगा? ELISA. And for obviously for diagnosis I will go for this western blot assay. So this western blot assay is obviously protein based. I know you remember from this west में क्या खाते हैं, this is piece of pizza, so it is protein based. ठीक है. So this is your HIV. This is HIV virus. Please remember GB120, P24, P31, P40. These are all for this HIV. This is your ELISA. ठीक है. Next we have to remember about breast cancer. Breast cancer related screening पे क्या क्या क्वेश्चन आ सकता है? If they ask you best screening for breast cancer should be mammography. ठीक है. If they are asking you to remember about young female for screening, I have to remember MRI. If MRI is not available, I can go for USG. If even USG is also not available, then we can go for this thermography. In case if that is also not available, then what we can do? Then for palpation by physician, if he or she is not comfortable with it, फिर हम क्या कर सकते हैं? We can go for this BAC. That is breast self examination. This is what you have to remember. And for ultimately for diagnosis, I'll go for this FNSC biopsy. ठीक है. So this is something a breast self examination you have to remember, and this is a mammography. ठीक है. Please remember, not useful in less than 40 years. उसमें हम usually we will go for this MRI. Very important. ठीक है. Next, so far so good. समझ में आ रहा है? I hope this is a quick revision of your things. I want a verbal response. So far so good.
Yes, sir.
Yes.
Okay, good. Next, we have to remember about cervical cancer. Cervical cancer, may please remember we will go for this VR test. That is for visual inspection of cervix. In this, we go for this visual inspection of cervix with 5% acetic acid. This is what you have to remember. Please remember, it's a 5%, not 15%, not 50%. ठीक है, इट्स अ 5%. देखो यहाँ पे होता पता है क्या है? यहाँ पे आपको दिख रहा है 5% एसिडिक एसिड, पढ़ते पढ़ते चल जाओ, बट इन एग्जाम व्हेन इट विल बी लुकिंग, अरे 5% था या 15% था, और वहां पे आप कंफ्यूज हो जाओगे, क्योंकि 5% भी आपको ऐसा ही लगेगा, 15% भी आपको ऐसा ही लगेगा. सो इट विल लुक सिमिलर इन एग्जाम, एंड देन यू मिस दिस पॉइंट. सो दीज आर स्लाइट पॉइंट्स जो आपको ध्यान रखना है. सो इट्स अ 5% एसिटिक एसिड. ठीक है, इफ दैट दिस इज नॉट अवेलेबल वी कैन गो फॉर पेप्समेयर, बट दिस VIA usually preferred. And for diagnosis, I will go for this colposcopic punch. Colposcopic punch, that is biopsy. Also, we can go for cone biopsy, but this colposcopic, that is punch biopsy. Punch biopsy is preferred over cone biopsy. So this is, you have to remember, we are taking there is a pap smear, we are taking as a pap smear, that is this as spatula से use करके. And this is your colposcopic punch biopsy. This is what you have to remember, very very important. ठीक है. Next, if I talk about this oral cancer, देखो oral cancer में हमको क्या याद रखना है? Oral cancer में हमको याद रखना है, for screening I will go for this bimanual oral palpation. And as a diagnosis, we will go for this FNSC biopsy. So this is something you have to remember. This is, as a visual question they can ask you, this is BAOMP, that is bimanual oral palpation, and this is for the biopsy. If I talk about this for the lung cancer screening, please remember we have this chest x-ray. Lung cancer के लिए screening के लिए we go for this chest x-ray, and we can also go for the sputum cytology. And over here, if I say, then we will go for this CT scan. Diagnosis के लिए there will be HRCT. And for prostate cancer, I must be knowing that आपको अच्छे से पता होगा, that is we will go for this PSA plus DRE together for prostate cancer. If that is not available, then we can go for this PSA. Even if जैसे एंटीजन के लिए भी हम नहीं जा सकते, तो then we go for this DRE. ठीक है. And for diagnosis, ultimately we can go for this FNSC biopsy. Last but not least, related to diabetes, very 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 important, that is screening is for RBS, random blood sugar. And for diagnosis, my fasting blood sugar more than 126, OGTT should be more than 200. OGTT में we usually go for this venous plasma glucose at 2 hours. ठीक है. मैंने आप लोगों को अच्छे से बताया था जब हमने पूरी क्लासेस करी थी, उसमें आई एक्सप्लेन यू दिस well. And this HbA1c more than 6.5%. So please everyone write in the chat section these values, very 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 highly. FBS more than 126, OGTT more than 200, and HbA1c more than 6.5. इसमें कोई confusion आपको होना ही नहीं चाहिए. I want reply from each one of you in chat section. Each one of you इसका रिप्लाई चाहिए. यू राइट, देन यू विल लर्न इट. एंड इफ यू विल राइट इट, देन डेफिनेटली आपको एक पिक्टोरियल मेमोरी, हाँ मैंने चैट सेक्शन में भी लिखा था 126 ही था, वो 200 ही था, वो 6.5 ही था, इस तरीके से. Okay, I hope everyone have responded good. Next, we have to learn about this antenatal visits. देखो antenatal visits ideally, or we can say total recommended is 13 to 14. 13 to 14. This you have to remember. Ideal पूछ रहा हूँ मैं, minimum नहीं बोल रहा हूँ. What I'm asking you to remember, antenatal visits ideally 13 to 14. Like from 0 to 7 month period of gestation, you have to come once per month. So जब से pregnancy like from 0 to 7 month of period of gestation हमको एक बार आना है एक महीने में, तो that will be my 7 visits. ठीक है. 8th month पे twice a month, यानी कि ठीक है 8th month में मैं दोबारा जाऊंगा, that is from 7 plus 2 plus then remaining is from 9th month onward, once per week. So obviously let's say 4 or 5, so it will become like 13 to 14. This is what I have to remember. तो if they ask you question कि ऐसा कौन सा मंथ है जिसमें ट्वाइस अ मंथ आना है, ऐसा कौन सा मंथ है जिसमें ट्वाइस अ मंथ आना है,
Eighth.
which month? हाँ,
Eighth.
8th month. Good. ठीक है. Next question they will ask you to remember about minimum antenatal visits. So for minimum antenatal visits, please remember these are four. एक तो first visit, during that we have to register that pregnancy registration. Next, please remember that is 14 to 26 week of period of gestation. Next we have this 28 to 34 weeks period of gestation, and then fourth visit will be at 36 weeks of period of gestation. So this is related to our. If they ask you for WHO, according to WHO, please remember this is minimum 8 antenatal visits should be there. Okay, according to WHO. Over here we have this four. This is what you have to remember. Very, very, very important. And for this 8 minimum visit, kab hoga? At 12 week, then 20 week, then 26 week, then 30 week, then 34 weeks, then 36, 38 and 40 weeks. So this will be all 8 visits. Please इसको अच्छे से याद रखना, and this range also you have to remember. So please, who will be giving me a verbal response on this? Let's say Akansha, would you like to give, or Anvesha?
Yes, sir.
Yeah, please.
Minimum antenatal visit, it is 4 according to Government of India. First is registration, and then 14 to 26 week period of gestation, then 28 to 34 weeks period of gestation, then 30.
Good. This is what you have to remember. So this is antenatal visits, right? And next we have postnatal visits. तो यहाँ से और क्या क्या क्वेश्चन वो पूछेंगे इस बार? They will ask you that according to that we usually add 3 to 4 postnatal visits. देखो, that will be usually by this MPW, that is multi-purpose worker, and also this will be done by this ANM, that is auxiliary nurse midwife, which is posted at sub center. तो यहाँ पे हमको फोकस करना, we might be having this home delivery or we might be having this institutional delivery. Home delivery पे usually the postnatal visit will be 4, and institutional delivery में the visits will be 3. Obviously क्योंकि day 0 पे तो वही delivery हुआ है, तो that will not be included over here. So institutional delivery and home delivery, please remember what will be the days. Very, very, very important. For home delivery postnatal visits में day 0, day 3, day 7, day 42. ठीक है. And institutional delivery day 3, day 7 and day 42. This is what you have to remember. This will be done by this MPW or ANM. ठीक है. Next question you have to remember, minimum postnatal visit by आशा. देखो, this MPW और ANM वाला भी चलता रहेगा साथ में, ये वाली विजिट भी चलती रहेगी. This both are different, this both are done differently. दोनों अलग अलग तरह से परफॉर्म की जाती है. ठीक है. So these are not related to each other, but these both are mandatory. This is something you have to remember. Minimum postnatal visits by Asha will be 6 to 7. This is what you have to remember. If they ask you कि आशा किस बेसिस पे विजिट करती है, on under what program, so you have to remember that visit of Asha is under home based newborn care program. Over here also, for home delivery we will have 7 visits. For institutional delivery we will have 6 visits. So home delivery for 7 days का visit क्या हो जाएगा? 0, 3, 7, 14, 21, 28, 42. ठीक है. And over for institutional delivery that is 6 day, that is okay. 0 तो उसमें होगा ही नहीं, तो it will be 3, 7, 14, 21, 28, 42. This is what you have to remember. This is what you have to remember. And please do not confuse this with रेबीज का वैक्सीन का स्केड्यूल हमने जो कल पढ़ा था, ठीक है। तो दिस इज व्हाट यू हैव टू रिमेंबर अबाउट एंटीनेटल विजिट्स एंड पोस्टनेटल विजिट्स, ठीक है। ऑल्सो दे कैन आस्क यू सम क्वेश्चन रिलेटेड टू दिस best indicators. If they ask you best indicator of virulence, or we can say killing power, best indicators of virulence or killing power will be case fatality rate. Case fatality rate एक क्वेश्चन हमारा डन। if they ask you best indicator of communicability of disease, any disease का कोई भी किसी भी disease का communicability आप कैसे इंडिकेट करोगे, बेस्ट इंडिकेटर दैट विल बी सेकेंडरी अटैक रेट, सेकेंडरी अटैक रेट। सो प्लीज रिमेंबर, दो क्वेश्चन हमने अभी सॉल्व किए, दैट द बेस्ट इंडिकेटर ऑफ वायलेंस और किलिंग पावर, माय आंसर विल बी केस फर्टिलिटी रेट। बेस्ट इंडिकेटर ऑफ कम्युनिकेबिलिटी ऑफ अ डिजीज, सेकेंडरी अटैक रेट। Also best indicator of disease burden in society, disease burden in society। तो उसमें हमारे पास या तो दो क्वेश्चन होंगे, if they ask you best indicator, or they can ask you simple indicator, sorry sample indicator। if the best indicator they ask you for the disease burden, please remember that is daily, that is disability adjusted life year, ठीक है। this is what you have to remember। and for this sample indicators, please remember we have this PMR, that is proportional mortality rate। आप लोगों ने क्वेश्चन देखे हैं ये while solving, क्वेश्चंस देखे हैं न्यू गाइस, आपने क्वेश्चन देखे हैं? आई वांट अ वर्बल रिस्पांस, आपने इस पे क्वेश्चन देखे हैं? गुड। आकांक्षा, आशीष, व्हाट आर अदर्स? श्रुति, गुड। नेक्स्ट वी हैव टू रिमेंबर अबाउट दिस ICDS। देखो ICDS में फर्स्ट ऑफ ऑल यू हैव टू remember this logo आपको अच्छे से याद रखना। this logo is for ICDS। now what do you mean by this ICDS? integrated child development services। what do you mean by this S over here? S means services, very 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 highlighting point, you cannot miss on this point, services, ठीक है। next we have to remember that heart of ICDs Anganwadi, and one Anganwadi center for 400 to 800 population for plan, and one Anganwadi center for hilly population is, उसमें population का range कितना होगा? 300 to 800। this is what you have to remember। over here the beneficiaries कौन होगा? beneficiaries कौन होगा? from 0 to 6 year children, NPNL, that is non-pregnant, non-lactating woman, obviously from 15 to 49 year of woman, also pregnant and lactation women, and also 11 to 18 year adolescent girls। तो इन सब को याद करने की वजह, लेट्स रिमेंबर इन दिस वे कि एवरीवन एक्सेप्ट एडल्ट मेल के अलावा जितने भी पॉपुलेशन में जो भी है, दैट विल बी कंसीडर्ड एज अ बेनिफिशियरी इन दिस ICDS, ठीक है। also which services this ICD provides, please remember they do not provide any services like OPD or IPD, not at all। they just provide you services as non-formal preschool education, also some health related education, immunization, family planning services, रेफरल सर्विसेज यानी कि उनको कुछ सिम्टम्स के बारे में बताया जाता है, थोड़ा ट्रेन किया जाता है, एंड देन if they suspect that type of disease, then we just ask them to refer that patient to particular center. We like ask them that don't try to be doctor. Over here also there in the ICDs, S services means free food supplementation। over here also वो कितना calories and proteins they are given on a daily basis, calories 1/3 calories and protein half of the protein on the daily basis दिया जाता है। also please remember one community development block carries 100 villages, that is for this 1 lakh population, and it comes under Ministry of Women and Child Development। this is what you have to remember, very 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 important। now if I compare this same scenario, it is calorie 1/3 and protein 1/2 over here with this is something midday meal program पे भी क्वेश्चन आता है, we have to be very focused over here, ठीक है। so midday meal program में how much calories we give, how much protein we give. Means calories is also one third, protein is also 1/2. And it is managed by which ministry? Ministry of Human Resources. So please everyone write in the chat section, midday meal program. Midday meal program is usually managed by which ministry? Just look it over here, और देख के याद करो, लिखो, and then move forward. It is managed by which ministry? Ministry of Human Resources. Good. ठीक है. Next, we have to remember that we have this primary beneficiary in अब upper primary. Primary मतलब कि फिफ्थ क्लास तक. तो फिफ्थ क्लास में यूजुअली कैलोरीज कितनी देंगे? 450 किलो कैलोरीज. एंड प्रोटीन कितना मिलेगा? 12 ग्राम्स ऑफ प्रोटीन. ठीक है. एंड 100 ग्राम ऑफ सीरियल्स. 100 ग्राम ऑफ सीरियल. एंड अपर primary means up till 8th class, 700 kilocalories, 20 grams of protein, and cereals 150 grams. This is what you have to remember. And this is the logo for this midday meal program. So you can see children's, right? Okay, with this plate. So this is your midday meal program. Very, very highly visual question. This is what you have to remember. This is what you have to remember. Okay. And this from यहाँ से will continue tomorrow in next session. ठीक है. Because this also requires an active participation, because these are very high yielding and also a little bit volatile. ठीक है. Little bit volatile. तो I want कि आप अच्छे से इसको अच्छे से रिवाइज करो, and then we'll move forward to further topics, for this further topics. ठीक है. So I hope समझ में आया आपको आज का सेशन. Or maybe we can take a evening session, whatever would be fine for us. We'll take it. Okay. So this is where we finish our today's session. Anyone having any doubt related to your preparation or related to this PSM? देखो, ये जो टॉपिक्स हम लोग करवा रहे हैं, जैसे कि कल के सेशन में जो हुआ, आज के सेशन में जो, और मे बी आने वाले फर्दर 2-3 सेशंस में जो होगा, that should be must to do, because these are, if you will try to calculate, मतलब 50 plus topics definitely हैं, और इनमें से most of the question will coming from this only. जैसे मैंने आप लोगों को समर्पित बैच में ऑलरेडी पूरा पीएसएम पढ़ाया, लाइक अच्छे से, है ना. एंड इन दिस we are just summing up the most important topics जो कि आपके फिंगर टिप्स पे होने ही चाहिए. इफ यू विल, अगर आपने अभी तक पीएसएम नहीं भी किया था, इफ यू विल डू दिस मच, देन ऑल्सो यू वुड बी स्कोरिंग वेरी गुड मार्क्स इन पीएसएम. बट यस, इट रिक्वायर्स अ लॉट ऑफ रिविजन. नॉट कि हाँ एक बार क्लास देख ली, एक बार वीडियो देख लिया हो जाएगा. नॉट एट ऑल. इट रिक्वायर्स अ लॉट ऑफ एफर्ट टू रिवाइज देम, एंड टू डू अ लॉट ऑफ क्वेश्चन, तब जाके वो आपको इंटीग्रेट होंगे आपके अंदर. ठीक है. सो शुड आई एंड दिस सेशन? थैंक यू एवरीवन फॉर अटेंडिंग दिस सेशन. विल मीट इन अनदर सेशन. थैंक यू सो मच.